Let's go to a health alert now. Fast spreading, drug resistant, and deadly. The CDC is warning tonight of a dangerous fungal infection that is spreading across the United States at what they consider an alarming rate.
Well, and we've learned that cases at this point have started to really skyrocket. New CDC data shows that there were 53 cases in 2016. Well, that number has jumped to nearly 1,500 by 2021.
Now, initially, those confirmed cases were confined to New York City and Chicago, those areas, but now it's present in more than half of the 50 states, and that includes Tennessee and Mississippi. Fox 13 health reporter Mandy Rock is with us in studio. Mandy, you talked to a doctor who said a few hospitals have already confirmed cases right here in the Mid-South.
Yeah, that's right. Dr. Michael Threlkeld at Baptist Memorial Hospital told me there have been a few cases of this fungus known as Candida auris confirmed in Tennessee and in Mississippi, but it hasn't been announced where in the states those cases are and in what hospitals. Meanwhile, the Shelby County Health Department said the fungus is something their epidemiologists are looking out for.
It's increasing nationwide, and now's the time for everybody to focus and be concerned about it, hence the warnings. But I don't think this is something everybody needs to panic over at this point.
A warning coupled with reassurance after the CDC issued an alert about the fungus Candida auris or C. auris. It's spreading quickly in healthcare facilities.
When it gets in a hospital setting, it can be spread more easily from person to person, and you can actually see 3 or 4 cases occurring sequentially or at the same time.
Dr. Michael Threlkeld is an infectious disease specialist at Baptist Memorial Hospital in Memphis. He said the yeast-type fungus can affect the bloodstream and can cause a high fever. What's worrisome is that it's been proven to be resistant to most common types of antifungal drugs. Dr. Threlkeld said patients who are immunocompromised are most at risk.
It's particularly prevalent is causing infections in patients who are already sick from something else. For example, patients that have had a major surgery, people that are on broad spectrum antibiotics.
The CDC is calling it a deadly threat, but Dr. Threlkeld said it's both preventable and can be treatable. People we talked to said they're taking precautions.
Do the research, calm down, because a lot of times when rumors or any kind of scares happen, there's scares, and people think irrationally.
Good hand washing and just universal precautions prepares for any and everything.
And because it's mostly spread in places like hospitals and nursing homes, Dr. Threlkeld said the main focus now is to prevent the spread in healthcare facilities. He said appropriate hand washing and cutting down on the use of invasive devices like IVs and catheters can help. Back to you.